Recently, when I came here and met Dr. Sara, who was new to this hospital, he was surprised to see my blood pressure high in spite of taking regular medicine. And she suspected that the primary issue could be something else. Hi there. Yeah, my name is Shaji Abdu. I've been associated with the Canadian hospital in Abu Hail for the last 15 years now. And I'm being treated for blood pressure, high blood pressure since then. And hence, we carried out some tests and found out that my aldosterone, the hormone which the adrenal gland is producing, was high, and decided to do a CT scan. And she suspected that my right adrenal gland has got a tumor.
In majority of patients, hypertension or high blood pressure is found to be primary, that is essential or idiopathic without any known underlying cause. A subgroup of patients may have an underlying cause of hypertension known as secondary hypertension. In such patients, hypertension can even be curable or at least better managed with targeted therapy. Primary aldosteronism is a condition which is the most common cause of secondary hypertension. We evaluated a patient with long-standing uncontrolled hypertension and found that he is having primary aldosteronism. His CT scan of the adrenal gland was showing an adrenal adenoma, which can be a possible source of his high aldosterone levels. However, the gold standard test to confirm this is adrenal venous sampling, which is a technically difficult and challenging procedure. I'm glad that we have an expert interventional radiologist who did this procedure of adrenal venous sampling for our patient, and we found that although his CT scan was showing one-sided adenoma, but he was actually having bilateral aldosterone axis. We started our patient on targeted medicine and his blood pressure is well controlled. He is doing well.
Hi everyone. As we know, hypertension is a very common disease and it can cause lots of comorbidities and complications to the patients if it's prolonged and untreated. Most of the cases with hypertension were idiopathic, which means there is no direct cause that can we correlate to the hypertension. Nevertheless, a small proportion of the patients might have a functioning part in the adrenal gland that produces hormones, certain hormones that causes the hypertension. This is usually seen in younger patients, and in these cases, the treating physician would like a procedure to go in and take blood samples from the veins draining the adrenal glands. This is a very complicated and sophisticated test because especially the right adrenal gland vein is very difficult to find and it needs centers with high expertise. So we were lucky that we had many of these cases before in the UK. We had done like maybe 10 or 15 and the results are amazing, and we are glad to say that we have performed the first case of adrenal venous sampling here in the Canadian Specialist Hospital, which was very successful.
I'm very happy that we had gone through this situation to identify the root cause of my blood pressure. Hope this will help me in reducing my medicine.
Keeping you well. Canadian Specialist Hospital, Abu Hail, Dira, Dubai.